Hello there. Welcome to my home here in Killiney. I'm talking about quantum biomagnetic therapy, meaning therapy given at a distance or remote healing, if you will. And I'd just like to do a demonstration on this right now and encourage you to perfect this treatment, because we're going to need it in these up and coming times so that we can balance the viral load of our patients remotely when we're unable to see them personally. The scanning technique is the same as you do with the feet, except it's done with the thumbs. So the thumbs represent the feet, and there is a shortening and lengthening and balancing with the thumbs. Okay, I'm going to demonstrate this. Some of you already have seen me do this, and you've tried this method of scanning the body. So, or some of you may just try with the thumbs. Anyhow, there is a way of scanning the body remotely using this method. This is my preferred method because it's banging the hands together, they remain balanced, and when you get a reading, you get this, a shortening of the right thumb, and that indicates a yes. So let's demonstrate it. Now I have here, kind permission of one of my clients, Frank, who's got a respiratory condition at the moment, and we're working with him. And as you know, in these times, respiratory conditions can be challenging. So we're scanning Frank remotely, and he's put me up to date on his current situation, which is cough much improved, breathing easier, very little phlegm now, so things are progressing. So we want to scan him today to find out what else needs to be done. So, like we've shown before, we are asking a question of the energy field, of the biological energy field, heart wisdom of Frank's body, asking it to tell us what are the microbes that are involved in these phenomena in the body. And just like you would do in an ordinary treatment, we are placing our hands, and I can see him here on the screen. We're placing our hands over his body. We're tuning into his liver, and we're marking it, and I can see him. His head is on this side, his feet are on this side. And so he's very kindly given permission for me to demonstrate this. So I'm imprinting on my hands the energy. I'm marking it on the upper ventricle of the heart as usual. I'm now tuning into his lungs. So I imagine Frank, I can see him lying there. I imagine putting my hands under his body, the upper torso, and sensing the energy of his lungs. And then I imagine I'm able to mark it on the upper ventricle of the heart as usual. Okay. And like all energy fields, it needs us to ask a question in order to bring that energy field into play. Now, at this type of approach, we are working on a quantum level. So on the level of the atoms, the electrons, the protons, and so on. So we're working on a quantum level. And on the level of quantum physics, non-locality is the law. So there is no difference between one locality in the field and another. Nothing's changed. I'm still scanning and talking to the body, but through the quantum field in this case. So our question, as usual, is, can you tell me the underlying causes. I'm asking the biological energy or Frank's body to tell me, can you give me the underlying causes of these things? And in that way, I'm going to ask, can you tell me the underlying causes of these things? And you see that the right thumb shortens, meaning yes. Now, you know how to input the intention, so I won't go over that again. But we want to ask the microbial causes of these things. Now, I'm demonstrating the microbial scan here. You can just as easily do a biomagnetic scan. But I find in remote healing and quantum bioenergetic healing that the microbial scan is by far the quickest and the most effective and the easiest to do. So we do a microbial scan. So I ask, like you would normally, is this a bacteria? No. A virus? Yes. Is it a parasite? A fungus? The main underlying cause for virus? Yes. Okay. Proceed. Is it a DNA virus? No. Is it a retrovirus? Yes. Is it rabies? Coxsackie? Aftosa? Influenza? Influenza? Yes. Now we come to inputting the biomagnetic force into the body. And you have learned on your program how to do this energetically by asking the body to give you the gauze, which is the strength of the magnet, and the number of minutes it needs to be in place. And we do exactly the same here, except that the readings you will get will be much higher than when you have the body of the person with you present in the same room on the treatment table. So now let's ask Frank's body, at what gauze does it require these inputs to be made? Can you tell me the gauze? Yes, it can. Is it 1,000 gauze, 2,000 gauze, 3,000 gauze, 4,000 gauze, 5,000, 6,000, 7,000, 8,000, 9,000, 10,000, 11,000? We get a shortening, a lengthening of the right side. As you can see, it's what you would typically see as a reversal. A valid reading nonetheless. And for how many minutes? Is it 10 minutes, 20 minutes, 30 minutes? 30 minutes. Okay. So what's that? 12,000 gauze for 30 minutes. Sorry, 11,000 gauze for 30 minutes. Okay. Let's proceed to input it. So input for influenza, trachea to trachea, 11,000 gauze, 30 minutes. Input trachea to trachea, 11,000 gauze, 30 minutes, and balance is just there. So we accept that as having gone in to energetic field of the body. Now I'm looking at you and I should be looking at him. Sorry about that, but it's a demonstration. If you're doing it, you know, you're tuning in to Frank here on your screen, you can see him, you're looking at the trachea, and in some cases I point to the trachea. I say trachea to trachea, I point to it, trachea, trachea, 11,000 gauze, 30 minutes. Input trachea, trachea, 11,000 gauze, 30 minutes. See, like that. Now, and so on. Influenza virus, is it H1N7? Yes. H1N9? Yes. H8N5? Yes. So it's many strains of the influenza virus. Is it the common cold coronavirus? Yes. And so on. So I hope this little demonstration just gives you a way of doing this. You need the confidence and the belief in it, and this can only be gained by practice. So I'd encourage you then to practice this. First of all, just doing this. I'd encourage you to practice it with foods to begin with. So, is this food good for me? And you get, in this case, I'm not looking at it. Let's look at a food over there on the table. I'm looking at a jar of honey. So inputting honey, and it's saying yes. It's a particularly powerful form of organic honey over there, so I'm not surprised. So you can practice with foods, and then you can ask for a volunteer, a member of your family, somebody who's in the same house, permission to scan them remotely. And they may look a bit quizzical at you, but nevertheless just say, look, I'm practicing doing quantum biomagnetic therapy. Quantum biomagnetic therapy is the name of what we're doing. Let's not mix it up, call it any other name. It's quantum biomagnetic therapy. Now, do that and practice on them while they're in a different room, and then ask one of your patients, would they be prepared to have a remote scan? And this is you asking them, so there's no charge for it, and then just practice it. Either microbial scan, biomagnetic scan, whatever you prefer. And build up your capability in this. This is really badly needed now. In these next few weeks and months, we're going to need to keep the viral load and the corresponding bacterial, fungal, and parasitic load of our clients in good shape. So our clients need us right now. So please practice this. Look forward to talking to you again soon. God bless for now. See you soon.